Obama administration considers it one of its crowning achievements, the Affordable Care Act, otherwise known as Obamacare. It was among the accomplishments the president touted during last night's State of the Union address.
And in the past year alone, about 10 million uninsured Americans finally gained the security of health coverage.
A short time later, Republican Senator Rand Paul delivered a response to the president's speech.
Today, more Americans may have medical insurance, but Americans are now paying more money for worse care. Everyone knows our healthcare system needed reforming, but it was the wrong prescription to choose more government instead of more consumer choice and competition.
So is Obamacare the wrong prescription? Just what the doctor ordered or somewhere in between? A new book called America's Bitter Pill explores the ins and outs of how this law was made and the aftermath. The author is Stephen Brill. He's also the founder of the Yale Journalism Initiative and of Court TV, and he joins me now. Steve, welcome.
Hi.
So let me ask you the big question right up front. You praise Obamacare for getting millions of Americans health insurance who didn't have it before, but you also say it helped feed this deeply dysfunctional system.
That's exactly right. Good news, bad news. Good news, more people have health care. Bad news is all the prices are still way too high, and what Obamacare does, which is the only reform that I guess you can get out of Washington, is it enriches the people, the industries in the healthcare industry that are charging too much money by creating tens of millions of new customers supported and paid for by the government to buy exorbitant prescription drug prices, to pay exorbitant prices at so-called nonprofit hospitals. Nothing about the pricing structure has changed. Just more customers.
Before I ask you about how the good and bad shake out and whether this is, ultimately a good thing or a bad thing, let's talk about some of those industries. I think a lot of us, when we think about healthcare and problems in healthcare, kind of think of the whole system as being flawed. But as you see it, there's a pretty clear hierarchy of who is making a killing off of our current healthcare system, and maybe parties that you think aren't as blameworthy that some of us tend to think of as well. So who's in that hierarchy?
Well, the drug companies are making a killing. The medical device makers who have a big foothold here are making a killing. The nonprofit hospitals pay exorbitant salaries, charge exorbitant prices, and you and I should be in that kind of nonprofit business.
Profit margins of close to 25%, right?
Well, in some cases. The average profit margins of the nonprofit hospitals are higher than the profit margins of the for-profit hospitals. Go figure. Oddly enough, the least bad actors in the whole situation in terms of ripping off the public are the insurance companies, who everybody loves to hate because they're sort of on our side of the equation. They pay medical bills just the way we do. They don't create medical bills. They're not the ones who are charging, $77 for a box of gauze pads at the hospital.
By the way, who is charging $77 for a box of gauze pads that you get for $3 at CVS?
There are various nonprofit hospitals all over the country that have charges like that, which are detailed in the book. The bills of various patients, which I sort of go through with a fine-tooth comb, line by line, and you often can't tell because the gauze pads may be in code, and you have to decode it, but that's what it is.
So you wrote that big article for Time magazine talking about healthcare costs with a similar or the same title, right? Bitter Pill or
sort of the same title.
Sort of the same. Okay, thank you. And then in between writing that piece and writing this book, you underwent a radical shift of perspective. What happened to you that changed your vantage point?
Very simply, I became a customer. I suddenly had an urgent need for open heart surgery, and I got great care.
And what did you have? It was sort of an aortic, the name of the heart condition.
Aneurysm.
Thank you.
You have like a bubble on your heart. You have no symptoms. I was feeling fine, worked out that day. But if you don't get that operation, you're in real danger that it'll burst and you won't even get to the emergency room. So I had the surgery, had a great surgeon, was at a great hospital. And I realized two things in an emotional way that I sort of knew intellectually about healthcare. The first was that when you're scared, you're not a very good customer. You'll buy anything, you'll pay anything, you're not asking what the price is, you have no idea whether you need 2 blood tests or 6 blood tests. You just rely on the people to do it. So the notion that we ought to make people have, quote, more skin in the game by being, and make them better healthcare consumers is absurd.
Yeah.
This does not work the way it works if you decide I'm going to go buy a new smartphone. It doesn't work that way. The second thing is I learned that because it's so emotional, because there's so much fear involved, politicians on both sides of the aisle can use that to exploit people and to make people think that the opposition's proposal is going to affect their health. And people
like with,
care
say,
more,
death panels.
like
right?
death panels. And people care much more about their health than they care about health care policy. You know, death panels was one of the myths that the opposition used. And the real irony of Obamacare is that it is a slightly more conservative version of something Richard Nixon proposed in the 70s to head off a liberal Ted Kennedy reform proposal, and it's significantly more conservative than what Governor Romney did here in Massachusetts.
Let me ask you about your take on President Obama's handling of both the rollout of the healthcare.gov website and his selling of the Affordable Care Act. You are really, really tough on the president. What did he do wrong? How did he screw up, and what do you think the ramifications are?
I think he did a great thing in pushing for this. He took responsibility, basically ownership for a really lousy system that he's going to get blamed for forever. What he did badly is called governing. There's a difference between having good policies and actually governing, managing the implementation of a law. He did a terrible job. He and Valerie Jarrett, who's his real chief of staff, as I found out in doing the book, basically resisted the suggestions of Larry Summers and Peter Orszag, who was head of management and budget, to bring in people from the outside because this was a complicated law, for starters, and the real key to the law, the launch of the most complicated e-commerce system ever envisioned, needed real experts. And they resisted doing that. They left the same, policy wonks in charge of actually mounting the website.
And multiple people were in charge, right? There was no clear...
No one was in charge. That's what I found out as I started looking at it. I asked, at the beginning of the reporting, I asked 7 different people, who's in charge of this launch? And I got 7 different answers. When you get 7 different answers, you know that there is trouble. And the real answer is the president was in charge, but he didn't pay attention to governing the way he pays attention to policy.
And you say he was also warned that he should not say, if you like your insurance, you can keep it, because people knew it wasn't the case.
The policy people and the economics people saying, your speechwriters keep writing the speech that says if you like your health insurance, you can keep it. There are a lot of people who are going to lose their health insurance, excuse me, because it's lousy insurance.
And he just wouldn't listen. All right, 2 brief questions to close out. On balance, it sounds like you think Obamacare, better that it passed with all its flaws. Okay, just wanted to get that.
Give me a heads-up choice. That's my choice.
All right, and my last question for you. Any chance that whatever we should be doing to fix health care in the U.S. actually happens? Could it happen politically?
It'll happen once there's a crisis, and the crisis is going to come because of the costs.
All right, Steve Brill, thank you for being here.
Thank you.